ILD or interstitial lung diseases are a whole group of disorders that affect sort of the internal parts of the lungs, and they're the parts of the lungs that are involved in how we transfer the gases that we breathe in and out, our oxygen and carbon dioxide. And when these diseases affect the lungs, they can cause inflammation, but more importantly, they can cause scarring or fibrosis. We don't have any treatments at the moment that reverse fibrosis, and unfortunately the fibrosis will progress over time. So this is a terminal condition and it may shorten a person's life expectancy. And it's important that people with these conditions are monitored so that the right treatment is given to them at the right time that's needed.
Traditionally, patients would be assessed by their GP, then they'd be referred to the local hospital, and from there they would have assessments and, if required, be referred to a specialist centre for the diagnosis and further management of their condition.
The purpose of the joint working project was to try and look at delivering specialist ILD care, so what we deliver from the specialist centre here at Papworth, out to patients in secondary care. So we knew that patients weren't having equitable access to care, so we've certainly had instances where patients were referred to Papworth but then weren't able to come up to Papworth because of transport difficulties or carer commitments, and they were cancelling appointments and therefore weren't eligible for treatments that can only be provided through the specialist centres. So what's different with this project in terms of clinics is that the patient is physically in Colchester, so they're not having to travel all the way up to Papworth.
So they come in the morning and they have their lung function test done, which is crucial for us clinicians to make decisions. They then go off and have an X-ray as well, and they meet Naomi, their specialist nurse, ILD nurse specialist based at Colchester. And then in the afternoon session, we have our joint clinic appointment where myself and Naomi are with the patient in the room for the consultation, and then we have the Papworth consultants video linking in with us. So we use Microsoft Teams, and that seems to work very well for us in terms of we set up a meeting beforehand and our Papworth colleagues dial in to Colchester.
So I'm able to lead the consultation from the speciality perspective in terms of listing the information that I need. We have dedicated study booths that are smaller and aren't in clinic space, so actually it means that we free up clinic capacity at Papworth, because even though I'm doing a clinic, I don't need all the clinical space.
The online facilities that allow me to speak to my consultant at Papworth from Colchester are excellent. It's done through a laptop with some quite clear speakers, so I can actually understand what's being said despite being deaf.
The role of the interstitial lung disease nurse has really been highlighted throughout this process. She does a lot of the coordination, she contacts all the patients, she requests their tests beforehand, she's with us in the appointment, and she provides a lot of the aftercare as well.
She's somebody who we've met, we've spoken to on the phone. She's like the linchpin holding it all together, really.
Working with the team at Boehringer has been an absolutely excellent experience, because through their specialist knowledge and their expertise, they've been able to provide us with the insights that we've needed for helping to produce a patient pathway working within the constraints and the requirements that the NHS has for us. But they've also helped us think about the data that we need to collect to be able to show that the pathway is effective and efficient. They've also been able to interrogate large data sets, which as a clinician we wouldn't be able to do and simply wouldn't have the time or resources.
But we have a really committed team, everybody works well together, so we're trying to pick off one bit at a time, and slowly but surely we are making significant difference and improving patients' lives.
This pilot has really demonstrated that if you can take away those regular, routine, in inverted commas, attendances for follow-ups and see those remotely from Papworth, it actually gives you then the capacity at Papworth to see more new patients with the same level of staffing than you had before. Overall, it enables the waiting lists for ILD diagnosis and treatment to come down.
Colchester is our hospital, it's up the road, so that is reassuring.
And to have the best of both worlds, having the input from Papworth, but we only need to come to Colchester, that makes such a difference.